Community health assessment includes monitoring of health status and diagnosis of community health issues. These assessments give detailed information about community health status and needs by providing recommendations and a framework for health agencies to identify needs within a population, factors that contribute to health outcomes, and resources available or not available in the community. These assessments also help form a community health improvement plan to provide a long-term effort to address health problems based on the results of the assessment. Community partnerships are essential when developing a community plan. Partnerships are relationships built between individuals to work together to achieve a common goal. Community partnerships involve collaboration and mutual decision-making by community members and professionals within the community. Community health assessment includes monitoring of health status and diagnosis of community health assessment. The information gathered in these assessments can develop a plan to improve these needs. Marion County ethnicity is a mix of Caucasian, African American, and Hispanic. The county has 3 lakes that surround its borders. Orange Lake is towards the northern part of the county near Alachua County. Lake Kerr is towards the northeast part of the county near Salt Springs, whereas near Putnam County. And then Lake Weir is the largest and most popular of the lakes, and that one is towards the south part of the county near Lake County. The county has several new houses and housing developments being built, but there are a limited number of houses for sale or for rent, along with apartments. Most homes in Marion County are well maintained, but there are some run-down or abandoned homes in the northwest part of the community. Silver Spring Shores in Marion County has a dump which is soon to be closed and relocated to the abundance of trash. The air quality in that area of the county is poor and smells immensely. The county is also known for its older community, so many of the medical offices are available, which makes it more convenient for members in the community, so they do not need to travel far to receive medical treatment. All schools within the community are newer or up to date. Buildings are clean and inviting, playgrounds are kept in good condition with beautiful surroundings and it's fenced in. Security is around to provide protection and crossing guards are available along with police to provide protection before and after school. Many options are available for recreational activities which include the ED Crossgrade Recreation Center, Lillian F. Bryant Community Center, City of Ocala Hampton Aquatic Center, Second Chance Community Park, Brick City Adventure Park, Ocala Tuscaloosa Park, Cohejo Park, and even the Ocala Rotary Sports Complex and Booster Stadium. Many of the parks in Marion County are kept in condition that is very scenic with trees and wildlife. Marion County is a small community and crime is becoming increasingly more popular within the community. Crime from 2016 to 2017 has increased by 2.9%. In 2015, the population of Marion County was projected at nearly 350,000 persons. With a large population, a higher level of social needs or issues are seen. Marion County has a less dense population than Florida does and is one of the largest counties by landmass in Florida. It is a mix of semi-urban and suburban cities. The demographic and structure of Marion County has a higher percentage of white residents and a lower percentage of black residents. The percentage of Hispanic residents in Marion County is less than half of what Florida is. Marion County also has a share of senior adult residents. Marion County's percentage of older residents is much higher than Florida. More than 26% of Marion County residents are over the age of 65. Due to the high percentage of these seniors in the community, the household and family size is less because many of these senior adults live alone. With this, an increase in health needs is also seen due to the aging population. The most pressing issue I have found is the community's health, especially diabetes. While Florida's death rate due to diabetes has leveled off during the past 10 years, Marion County death due to diabetes rose about 25.2 per 100,000 people between 2013 and 2015, according to the Florida Department of Health. The nursing diagnosis I came up with is risk for unstable blood glucose among families in Marion County related to knowledge deficit, inadequate education, lack of adherence to diabetes management, inadequate blood glucose monitoring, fluctuating physical activity level, lack of screening, and lack of outreach programs to identify at-risk individuals. All these led to my nursing diagnosis of ineffective health maintenance. For my community project regarding discharge education on diabetes management, my community partnerships included the nursing staff and leaders within the organization I work for. I collaborated with the nursing staff to understand the reasoning behind the lack of education regarding diabetes management at discharge and assess the nursing needs. I then investigated the availability of diabetic education to see if the organization lacked access to these resources. I also collaborated with leaders in my organization about the implementation of diabetic discharge education packets and then spoke to the pharmacy and case management to understand what problems patients run into regarding access to their diabetic medications, such as lack of insurance or minimal coverage of the cost of diabetic medication. The packets were constructed with information from the hospital's database called Claims on Demand for patient education. I printed the necessary information and put it into folders provided by the hospital with the hospital's name on it. I made several copies of these packets available for staff nurses. Then I made a copy packet to keep in a file cabinet so when the packets ran out, more can easily be constructed. In-service education was also provided, and the packets and what is included in the packets was verbally communicated to the staff nurses. Many factors go into a community health assessment. Each factor is a representation of how the community is or is not thriving. Community assessments highlight concerns that should be addressed and gives details on categories that affect a community's health. The older population of Marion County weighs heavily on health comorbidities and mortalities. Planned partnership and collaboration from individuals at my place of employment, including nursing staff, organizational leaders, pharmacists and pharmacy technicians, and case management. Each partnership added value to my project that resulted in increased patient care and the needed assistance to meet the needs of patients.